Hello, Bernadette Winters-Bell, your host of the podcast From Heartache to Healing and Hope. And in this third season, From Heartache to the Art of Healing, as I always say, I have a very special guest. And today, from the Louis Armstrong Center for Music and Medicine, is Andrew Rosetti. Andrew, welcome to the podcast.
Hello, pleasure to be here.
Excellent.
Thank you.
So since you probably know yourself better than me, would you introduce yourself to my audience, please?
Sure. I am a licensed psychotherapist in New York State, a board-certified music therapist, and I'm the director of Oncology Music Therapy at the Louis Armstrong Center for Music and Medicine here in New York City at Mount Sinai Healthcare System.
How long has the center been in operation?
Oh, the center itself has been in existence for about 23 years. And it was stewarded and created by Dr. Joanne Lowy, who is a colleague and a good friend at this point. So oncology and music therapy, perhaps strangely enough, are something that actually have quite a long history of going together, because it's not an uncommon thing here in the States and in many parts of Europe at this point for music therapy to be part of the chemo infusion suite experience for patients. So our program is a little different in that it focuses on radiation oncology, which is an area that has very typically been ignored by most music therapists. And that part of the program in and of itself, about 23 years, and this program in radiation oncology has been in effect about 11 years at this point.
And why did it get invited late to the party, do you think?
To me, it seemed totally logical that music therapy should be, very much should be part of what goes on in radiation oncology. There are many patients who are traumatized by treatment itself, by their diagnosis, difficulties with illness burden and treatment burden, and that seems especially so in this very, very fragile environment. So when I got hired to implement a program here at Mount Sinai, I thought that the most logical thing would be to start it off in radiation oncology. And so far, at that time we were the only existing music psychotherapy program in radiation oncology anywhere.
Wow, that's amazing. And had you done work like this before, prior to Mount Sinai?
Okay, so my background as a therapist is in acute inpatient psychiatric care, and that's what I had done for my years as a therapist. Before I moved back to the States, I'd lived in Europe for about 35 years, in Barcelona, Spain, actually, and so that was my area of focus. But when I moved back to the States, initially that was to Chicago, and that was once again to implement a music therapy program, but in neonatology.
And was that for the babies and the families also?
Babies and for the neonates, for families and for staff as well.
Oh, how wonderful. And you could easily visualize it having such a calming effect.
Calming is one thing that we do. One of the easiest things to do with music is to sort of help people downregulate, to change emotional response. Music is just such a wonderful regulator of emotional response. It's something that we all of us pretty much use on a very regular basis. But there are many other things that we could do with music in the context of clinical music therapy, which is not just passive music listening. But as I mentioned when I was introducing myself, I'm a licensed psychotherapist, so we use music in the context of psychotherapy.
Tell me more. This is fascinating.
Many of the things that I do for patients here in oncology is not just help sedate them, although anxiety is certainly a something to be addressed, but I also provide procedural support during venipunctures and blood draws and cannula placement, things like that. Also, I treat patients for a number of emotional disorders that sometimes they're comorbidities that they come in with, and sometimes they're things that are developed during their illness. So depression is one of the bigger ones, but there's a whole spectrum of emotional disorders that we work with. Post-traumatic stress, at times post-traumatic stress disorder. It's trauma is something that often is very common, but is not often well addressed, and so trauma that is not processed and integrated is something that gets carried over into other situations, other experiences that people are in, and medical treatment, a life-threatening diagnosis, the way people respond to their diagnosis of cancer is often in and of itself traumatizing. So one of our areas of focus, one of our areas of expertise, is working with traumatized patients as well. So far beyond simple listening to music.
Love it. Right, because that's the place people probably go to first when they think of what you're speaking about.
Sure.
There's a group in Minnesota, I think, Feast of Crispian,
Mm-hmm.
and they do work. One of the pieces of work they do is with veterans with PTSD
Mm-hmm.
and Shakespeare, which again doesn't at first blush go together easily. And so we'll have two veterans and two facilitators beside them, and they know the stories. And they give them words from Shakespeare, which is full of violence and, death and things. And they'll just give them words from any story. And the man slayed the other one and did this. And they're able to begin to find their voice in a way that's unemotionally attached to the context. And they're just repeating it. And they switch off to each person. And then they give them words from their own story. And when you were in Iraq, you were in this situation where you shot someone, and they just repeat what's said to them. Mm-hmm. And so they don't have to look for the words, but the emotion's already going, and then they put their words there. And they've helped so many people doing that because it touches a different part of their brain, just like music does. They're not directly going to thinking about or feeling.
Exactly.
Yeah, it's pretty interesting, all the different ways that it can be addressed.
Sure. I remember you telling me about this the first time we spoke. And yeah, it's a fantastic idea. Once again, as you said, it's using something as a transitional object. It's something that's a symbolic representation of something. And so the person with PTSD is not really talking about their experience directly, but in a way that's once removed. And that's actually a great safeguard to help from re-traumatizing patients as you're treating them.
Absolutely.
Because the old way of treating trauma was desensitization, which was all about having the patient tell their story and then have them tell it 1,000 times more, was what they used to say. We've seen at this point that desensitization is not the best approach.
When you came to a place to want to work with your patients and music, how did that combination come together for you?
Well, I guess it was a series of unplanned events, because as most people. Back in the day, I didn't even know that music therapy was something that existed. I'm talking about, maybe 20, 25 years ago. But it was just a matter of happenstance, at the time I was a professional musician, and I had always been very, very interested in psychology. At one point, I had to make a decision whether to study music or whether to study psychology. Chose music, but it was something that I always sort of did more or less independent study on. And through a series of events, being invited to teach applied music skills in a master's music therapy program, I actually discovered what music therapy was, and it just seemed like it was perfect.
Oh, for you, absolutely.
So,
and what kind of music did you play when you were just doing music?
Well, I'm classically trained. I played classical guitar, but being a child of the '60s, I started out on electric guitar playing rock and roll, like most kids my age back then. At one point, I sort of went back to playing electric guitar as well, and played in a few different bands and things like that.
And when you're using music therapy and acting as a music therapist, I would imagine that any venue of music is open to you.
Oh, of course. I mean, we found that, and this is something that the research backs up, is that the most effective music to start off with is patient-preferred music. And I don't think that's rocket science. There are lots of what you might call self-help products, wellness products out on the market that use things that they're calling relaxing music, or any number of internet servers that provide music, that have music programs that they put together that are relaxing, or they're energizing, or they're this or they're that. But what the research showed us is that, at least in a clinical context, that the thing that works best is the music that a patient prefers. And if we think about that for a second, I happen to like lots of different kinds of music. Many of my patients don't. So if I were to come up with something that I think is, for me, very relaxing, but it's something that doesn't connect with them on an emotional level, on a symbolic level, on as far as music having a certain significance for them, it's something that they're either not going to focus on, which sort of, that would sort of put an end to the whole process, or it's something that they would ask to be turned off.
Right. Like if you gave me Led Zeppelin, I wouldn't be relaxed.
I can't believe you don't like Led Zeppelin.
My husband and child do. Does that count for anything?
Right. No, but actually any music at all has to be relaxing. And this is one of the things where, that, at least from my point of view, is an error in ways that people who are not therapists use music for what they call therapeutic ends. And so first of all, it's not, even though what you play is very important, it's how it's played that makes a big difference too, which is one of the reasons why we use almost exclusively live music in our practice, because live music is something that I can change in a moment's notice. I can make Led Zeppelin sound like a lullaby.
Well, you didn't tell me, so you're a magician.
No, actually, no, it's actually pretty formulaic. It has nothing to do with magic, just with paying attention to specific elements of music, such as tempo, register, harmonic complexity, melodic complexity, and modifying those to modify the response that you want to engender in your patient.
What's the most surprising thing you've learned doing this work?
The most surprising thing that I've learned doing this work, is the amount of trust that my patients seem to invest in music therapy and music therapy services.
That was surprising I bet you knew that they were going to have some music that they liked, but not, I guess it's not a given, of course, that people would just trust this type of therapy, especially prior to having radiation or chemo or type of
Sure.
therapy.
Yeah. Yeah, I think that's a good way to look at it. Most of my patients, or well, maybe this is changing because music therapy has been in the media so much lately, and in magazines. There are a few articles that I was interviewed for in a magazine called Women's Health. Also, an article in the New York Times that featured our work as well. So I think music therapy is becoming more well known, just part of the collective consciousness of people, especially here in the States. But yeah, I'd say that a fair number of my patients really have no idea what music therapy is, at least accurately, have any idea what music therapy is going to be. They think that they're music therapy, oh, somebody's going to be putting on a CD for me, a relaxation CD or something like that. And actually, the interventions that they get are quite different than that. I think that they are pleasantly surprised, finding out that the first day that they're coming in for treatment, the first intervention they get is actually music therapy. So on their first day, they're in here for music therapy. What we do with patients on the first day is a protocolized intervention that involves orientation and habituation to the more somatic experience of what they're going to be going through that day, and also there's a protocolized intervention that works at lowering their state anxiety, providing them with tools to be able to do that when they actually go in and start the procedure, the medical procedure itself. There is a technique to show them how to make a rather uncomfortable chair feel more comfortable, because the treatment table is something that I know from experience is very uncomfortable. And so the last is guided visualization and music. Two is a preemptive intervention for claustrophobic or phobic events in general. So I don't think anybody comes in with the idea that they're going to be getting this intervention and a set of resources that they can use for themselves during treatment as needed.
I think that's one of the most important things I just heard you say, is that besides that you're giving them something that's not what they were anticipating perhaps, but the strategies and coping techniques you're teaching them right before treatment, and they have them to access right now, and that's important. One, to show it to them and explain it, but to be able to give it to them in a way that they can use it right away in a difficult situation. That's terrific.
Mm-hmm. Yeah, we like to think so, and actually we did a clinical study on this protocol, and we got very, very robust outcomes.
So you find that you're able to then clinically measure the lowering of their anxiety, and from their experience, how much better it was for them than they had anticipated or feared.
Absolutely. That's actually something that's pretty easy to do.
Wow.
The measurement, I mean.
Right,
Yeah.
right. Absolutely. What was a success story that really sticks out in your mind as that you really had an impact that stays with you?
I have a pretty heavy patient load at this point. I guess I can say that I've seen thousands of patients. I've never actually counted how many, but for the most part, the outcomes of the intervention, I'd have to say that the vast majority are constructive. And I don't want to be presumptuous, but yeah, I can think of a number of patients who were particularly fragile, who were distressed, having difficulty regulating their emotions, and saw from the intervention that they did better.
I think a piece of it comes to mind for me, that when you have a center for medicine, the music and medicine, so of course it tells them how much substance has gone into this: belief, money, structure, and that they're going to be taking, your organization is going to be taking care of them, the whole person, not just, okay, we're going to take a picture of over here or zap this and let me tattoo it up for you. And when you come in, wear this kind of shirt and do this. And all of that may be part of it, of course, for it to be effective. But you're addressing their fears, their concerns, their spirit, their anxiety, their expectations. And to do that says, I see all of you, body, mind, and spirit, and we're going to give you tools so that this could be a good experience.
I agree with what you're saying. This is a focus on integrative care in the true sense of the word. So I work very closely with the other professionals here, especially in radiation oncology. The radiation therapists, those are the people that deliver the radiation itself. There are a number of physicians here. We have a physics department. We have nursing, RNs, and nurse practitioners. And we all work very closely together to coordinate care, to sort of provide this holistic approach to working with the whole patient, not just the disease. It's not just about treating the disease. It's about the who the patient was before they became seriously ill, and helping them work through this often change in their sense of self that happens when they become a patient and a sick person, right?
Absolutely. You know, in the work that I do as a life loss and grief therapist, and people are coming to me after experiencing a loss or trauma. And we're looking at who they were, and we put a demarcation place somewhere, maybe a death, loss of a job, a lifestyle. And then we look at who they're becoming now, which to my mind is ongoing. I call it percolating. Remember those old coffee pots, and it would percolate up?
I do indeed, yeah.
And so that's an ongoing process. And then also what you're doing affects and addresses the person they're going to become. Because as opposed to later, say when they're recounting the story, this is how I had these are my symptoms, that I got diagnosed, and then I went to this music therapy. You can't believe it. And then they made me a customized playlist and did this and played music and did this. And it fits into the whole story of the three different parts, just like you're talking about. It absolutely allows them to have hope infused into their story, which I always think is essential.
I think that's a good point. Hope is a wonderful thing to be able to have. I believe that along with hope, that there are it's equally important to find moments of joy, as strange as that sounds.
Not at all.
Yeah, in treatment. And this is, I think, something that's part of the process of being able to integrate experiences and you know, for lack of a better way to put it, to move forward. Not to let go of it, not to move beyond it, but to move forward.
Exactly. You know, I talk to people about the gifts of the dying, the gifts of the grieving, the gifts of pandemic. And most of the time people don't like the word I'm using initially, gifts. But I'm not Amazon and they can't return it. So I'm sticking with But what I'm talking about is in processing these situations, and there's a lot that's difficult there. You still receive gifts in perhaps your growth or your knowledge or the new person you're becoming, which would not have happened if not for this trauma, this loss, this disease, whatever it is. It doesn't mean you wouldn't get the gifts back if you could and go back to who you were, but that's not a possibility. But I think that, again, is part of the holistic part, not only of being treated holistically, but of seeing yourself holistically in maybe a way that says, I went through this horrible thing, I received these gifts, this is more who I am.
Sure. Potentially every adverse experience is an opportunity for personal growth. Now, that's not something I would ever tell a patient directly. It sounds flippant, but it's actually true. There are people who get through treatment and actually flourish. There's real personal growth that takes place there.
You know, I mention it to my clients along the way, not in the beginning, but when they're coming to a place where often they're feeling guilty because something good is happening or they're enjoying something and they don't feel like they should because they came to me with something big and negative, you know, but that's all part of it, you know. And also, I always think that there's hope, no matter what the situation, but hope changes, you know. I don't have hope that I'm going to hop out of bed like a 25-year-old and go about my day, but there's always hope. And the joy that you speak of, I think, is also essential to keep inside our spirit, inside of ourselves. You know, to me, that's different than being happy. Happy is an ice cream cone. It's conditional. But joy is something you can foster inside of yourself and keep that flame, that light going. And you may not always feel it, but that doesn't mean that it's not there.
Oh, of course. Yeah, I agree. Yeah, I mean, there are plenty of times when during the course of treatment, when patients experience truly profound things. Not all of them are on the negative end of the negative part of the spectrum, right? You know, it's always my hope that we could find a way to help people experience more of those things.
Where do you see the future of this going? What's next?
We always have lots of projects. We're actually a sort of big music therapy program. So we have 8 therapists. This year, 13 interns, master's level interns, 2 research assistants, medical director. And so we are very interested in research. I think 5 RBL approved research projects in motion, and really happy to say that we got our first government grant this year.
Congratulations, yes.
Yeah, thank you. National Endowments for the Arts. There are lots of things already in motion. We started our first animal-based study as well with mice and chronic pain.
Wow. And would your area include those that are terminally ill and dying, actively dying?
Sure. So what I oversee, the part of the program that I oversee is in oncology, but we're pretty much serve, I can't say all of the units in the hospital because we're not a big enough department to be able to do that. But palliative care, end of life care is an area that we've been involved in for many years before I started working here. Pediatrics, the pediatric emergency departments, neonatology, the NICU, surgical ICUs, medical ICUs, general medicine, inpatient, psychiatric care, So we serve as many of the units as we can. We do practice what we call a strategy of continuity of care, which is the idea of following a patient, if we can, throughout their entire treatment trajectory. And so typically for many oncology patients, that means chemotherapy, surgery, radiation oncology, and for some patients, palliative care as well. You know, the arts in healthcare is something that over the past maybe 5 years is something that's really starting to take off. Here in the States, there are many programs. It's becoming fairly common in hospitals to have at least a small music therapy department. It's also growing exponentially in Europe and Asia, especially mainland China. I've actually been there 5 times to teach over the past years, and really interesting, sort of a cultural phenomena, because psychotherapy was not something that was particularly well regarded or popular in mainland China, and it is very quickly becoming extremely popular. Let's put it that way.
Well, that's a surprising thing, and welcome for me to hear. That's lovely.
Yeah.
So many different places and different, like you say, cultures and ideas and traditions, and that they can be open to different modalities, so that we all can become healthier, hopeful. Well, this has been an extreme pleasure, Andrew. I thank you so much for coming on the podcast, especially in this season that I'm calling From Heartache to the Art of Healing. And you're doing the art and science with much skill in helping people to heal. So thank you so much for speaking with us and for the work that you do.
Well, thank you, Bernadette, for the kind words. I really do appreciate that. And it's been a pleasure getting to talk to you again.
Excellent. Now tell my audience where they can find information about this great program.
So you can either Google or directly type in www.musicandmedicine.org or .com, and that will take you to the Louis Armstrong Center for Music and Medicine's webpage. And there you'll find lots and lots of information about music therapy, about practice, music therapy practice in hospitals, and quite a few videos.
Oh, one last question. Why Louis Armstrong? Was he big on this connection of music and medicine?
Oh, that's a long story. But I'll bring it. I'll give you a quick rundown. So Louis was a patient at Beth Israel, which is we merged with Sinai a few years ago. So Louis was a patient at Beth Israel. He was very, very pleased with his care that he received there, and he made a decision before passing that he wanted to leave some funding for some sort of program in the hospital that would include music and children. As luck would have it, his publicist, a very wonderful woman named Phoebe Jacobs, met the director, well, now the director of the program, Dr. Joanne Lowy. Joanne actually was a patient at the time, and she met Phoebe, and they spoke about music therapy, and Phoebe said this is exactly what Louis had in mind. So that's how the program actually started off at Beth Israel and now Mount Sinai.
I just love it. And I also loved when I met you at the yearly
fundraiser,
the fundraiser, and they said they were serving Louis Armstrong's favorite foods, and one of it was matzo ball soup. I just loved it.
I know, yeah.
No,
that was funny.
Well, thank you so very much, and I can't wait for my audience to hear this. It's going to be enlightening, educational, and hopeful for so many people. So thank you, Andrew.
Thank you, Bernadette. Looking forward to seeing you again.
I'll be down.
Okay.